Mitral stenosis is narrowing of the valve between the left atrium and left ventricle. Left atrium is the left upper chamber which receives oxygenated blood from the lungs. Left ventricle is the lower muscular chamber of the heart which pumps oxygenated blood to the whole body. Mitral stenosis is usually a sequelae of rheumatic fever, a disease which affects the major joints and heart valves. Another form of mitral stenosis is due to calcification of the mitral valve base seen in elderly. Mitral stenosis is a progressive disease with the obstruction progressing gradually. It can occur in young age in developing countries and is then known as juvenile mitral stenosis, typically before the age of 20 years. It can also be adult onset and late onset depending on the time at which symptoms start. Juvenile mitral stenosis usually progresses more rapidly than the other varieties and is thought to be due to recurrent episodes of rheumatic fever. Obstruction to the blood flow from the left atrium to the left ventricle leads to damming up of blood in the left atrium. Left atrial pressure rises and is transmitted back to the pulmonary veins which carry oxygenated blood from the lungs. When the pressure in the lungs go high, typically above 25 millimeters of mercury, fluid starts collecting in the tiny air spaces of the lungs known as alveoli.